Welcome to EMSI. In this video, we'll guide you step by step on how to properly set up and use your new Flex-MI home electrical stimulation unit. The Flex-MI offers both neuromuscular electrical stimulation for strengthening atrophied muscles and reducing muscle spasms, as well as interferential current for pain control. This video will focus on interferential current, also commonly referred to as IFC. We'll cover sample electrode placements and diagnosis-specific settings to help you get the best results. For NMES applications, refer to the dedicated NMES instructional video to ensure proper configuration and treatment protocol. Let's get started. Let's go over what comes inside your Flex-MI box so you'll be fully prepared for setup. When you open the box, you'll see the Flex-MI device and battery pack. Lift the white plastic device frame to reveal the device charger, a set of lead wires, a quick start guide, and a pack of 16 electrodes. Inserting the battery. First, ensure that your EMSI battery pack is installed properly. It's important not to remove the plastic wrap from the battery and ensure that the logo is facing right side up as shown here. Before using your Flex-MI unit, make sure to fully charge it to ensure you get the maximum intensity during treatment. To charge the unit, plug the male end of the charger into the port on the right side of the device and plug the charger into a wall outlet. A flashing low battery icon is an indication that it's time to recharge the battery. Please note, the device will not operate while it's charging. You'll see a blinking green light while the unit is charging. Once it's fully charged, the light will turn solid green, and your device is ready for use. If you see a blinking or solid red light, there's an issue with charging. Contact your local EMSI representative or EMSI customer service for assistance. Connecting the lead wires? Next, plug both lead wires into the top of the unit. No need to worry about which side they go on. The lead wires are interchangeable. Make sure to firmly press the lead wires into the device until they're fully connected. Connecting the lead wires to the electrodes. Next, insert the red and black ends of the lead wires into the white tips of the electrodes. Push them in until they're snug. Placing the electrodes to treat pain. Place the electrodes directly on the skin around the area of pain. We recommend arranging them in a square pattern. For example, with back pain, place 4 electrodes in a box shape about 3 to 4 inches apart. Make sure the lead wires are connected in a crisscross pattern, forming an X over the painful area. Electrodes can be reused until they no longer adhere to the skin. When this happens, use a new set for your treatment. To extend the life of your electrodes, make sure you're placing them on clean, dry skin with no lotions or oils. Setting up your device. To power on your unit, press the green button on the top left-hand side of the device. If you're using your Flex-MI to treat for pain, press the EMS-IF button on the bottom right-hand corner of the device until IF is showing on the top right of the screen. With the device in IF mode, it's now time to set the parameters. Press the Set button in the middle of the device and use the up and down arrows to select the desired waveform. Press the Set button again, then use the up and down arrows to select the pulse rate recommended by your provider. The device timer is automatically set for 15 minutes and will begin counting down as soon as the treatment session begins. At the conclusion of 15 minutes, the unit will power off on its own. To adjust the session time, simply press the clock icon at the bottom of the unit. Then use the arrow buttons in the middle to increase or decrease the time. For your safety, the unit automatically locks after 1 minute. To unlock the unit, press and hold the key button on the bottom left until the key icon is no longer displayed at the bottom left of the screen. IFC electrode placement and sample settings. The following settings are to be used as a guideline. Consult the prescribing physician or therapist for recommended settings. Refer to the device user manual for warnings, precautions, and contraindications, or contact an EMSI representative for any questions concerning the use of the device. For the treatment of neck pain, the mode should be set to 10/10 with a rate ranging from 80 to 100 Hz, with a recommended treatment time of 30 minutes 2 to 3 times per day. For lumbar and thoracic pain, the mode should be set to 10/10 with a rate ranging from 100 to 150 Hz, with a recommended treatment time of 30 minutes 2 to 3 times per day. When treating hip pain, the mode should be set to 8/8 or 10/10 with a rate ranging from 125 to 150 Hz, with a recommended treatment time of 30 minutes 2 to 3 times per day. For the treatment of shoulder pain, the mode should be set to 10/10 with a rate ranging from 80 to 150 Hz, with a recommended treatment time of 30 minutes 2 to 3 times per day. For wrist pain, the mode should be set to 8/8 with a rate of 100 Hz, with a recommended treatment time of 10 minutes 2 to 3 times per day. 4 electrodes should be placed in a crisscross pattern, with 2 on the palm side of the wrist and 2 on the back side of the wrist. When treating elbow pain, the mode should be set to 8/8 or 10/10 with a rate ranging from 80 to 100 Hz, with a recommended treatment time of 10 minutes 2 to 3 times per day. For the treatment of knee pain, the mode should be set to 10/10 with a rate ranging from 80 to 150 Hz, with a recommended treatment time of 20 to 30 minutes 2 to 3 times per day. For foot pain, the mode should be set to 8/8 with a rate of 100 Hz, with a recommended treatment time of 30 minutes 2 to 3 times per day. Once your electrodes are correctly placed and your device is set according to your prescribed settings, you're ready to begin your treatment. Make sure your unit is powered on and set to IF mode. To increase the intensity for both channels, all 4 electrodes, use the plus button on the right-hand side. Gradually press the plus button until you feel a strong but comfortable sensation. The stimulation should never be painful or uncomfortable. Thanks for watching the Flex-MI instructional video. We hope this guide helps you feel confident using your new Flex-MI device. For additional support, please contact your local EMSI representative.
EMSI, improving quality of life, one patient at a time.